got tightness of the muscle in here between her thumb and her index finger. So one thing you can do for it is to put some pressure on it that way. But another choice is to take a clip like this and just use the clip to give it a little support between there and let it kind of give time for it to melt. The muscle.
Melt?
Melt in a sense of relaxing the tight muscle. So you leave it on for a minute, maybe up to 5 minutes. You can see when you extend your thumb, you're using this long muscle here, and that's overpowering all the little muscles in your thumb.
That's why I don't know if
And you're
it's now,
getting
but
into this abnormal position of your thumb, so you're going to want to try and do things to help to promote having this nice gentle curve. Okay, so all the exercises I'm going to show you are going to be focused on curving, helping to strengthen the muscles to help you keep that. So the first one is to imagine that you're a puppet hand and you're talking with your mouth, this mouth. So rest your thumb there and just kind of use the muscles under here, strengthen them to bring your...
Would you do it so we can see how to do it?
Just to come out.
Oh, rolling it back and
Yeah.
forth.
So you're
Okay.
using the muscles under here,
Oh,
to bring your thumb open and away. Okay.
Am I doing it or not here?
Yeah, that's
Okay.
pretty good.
Okay.
And you feel that muscle strengthen.
Yeah, I do.
Okay.
Oh, huh.
The other thing you want to do is imagine that you're making a C,
Yeah.
a nice strong C, and be
See,
strong
I feel
about it.
pain doing that.
Okay.
Yeah.
Where do you feel it?
Right around here, I guess.
Okay.
Yeah.
And so see, it's kind of angulating out because it's tight in here.
Okay.
So imagine that your C is giving you a curve and you're strengthening all the muscles that hold your hand open like that. Yeah, make it a bigger C. And you can do both hands.
What are you supposed to do with the
The thumb should curl around lightly. Okay.
like that?
Well, you're making a small C, so you can make a bigger C. But so what I'm looking for is that you're using the muscles that open it from here rather than strain this joint. So
Could you set it where it's supposed to be, the way it is?
well, bring this finger around,
Okay.
and you should be able to hold this kind of position here. Okay?
Like that?
Hold it. Be strong. Don't let me push you.
Oh,
Okay.
okay.
Okay. So that's your C. Okay. Then the next thing I'm going to show you is a muscle that helps to anchor the base of the thumb. And basically, it's a muscle that is used to bring your finger out to the side. It's called the first dorsal interosseous. And I know it's a fancy word, but it's basically a muscle right in here. And you can feel it pop out when you move your index finger out to the side. Feel it right there. See how strong that is? Even curl your finger. You don't have to be so pointy. So the focus is that muscle right there. What it does is it anchors. It attaches to here at the base of the thumb, and it actually stabilizes this joint right here. So it's a good one for strengthening and stabilizing. Okay. So you can also touch your thumb to the tip of your finger and work your finger this way, so you're getting a little more.
How many reps would you do this?
Oh, 5 to 10.
Oh,
Okay.
Okay.
So that's called a closed chain exercise, when you hold your thumb and finger, so you're not moving there, but you're moving proximally.
How many times a day would you do this?
Oh goodness, I'm terrible at
I mean,
sitting.
If I do it
many
one
times,
time,
once,
I would-
twice.
Yeah, try once, and then if you're relaxing and
Yeah, I
you feel
could
like you
just
want to
do
fiddle
it.
with your exercises while you're doing something else, you can be doing it anytime. Yeah.
Okay.
Okay, a couple more. One is strengthening as if you're pressing your thumb down into a piano.
Okay.
So just imagine, you're using the muscles in here to press down, so you're strengthening.
So right under here, it's not touching, right? Or
Yeah,
it is?
well, it
can
could
touch.
it could touch.
But you're just pressing
You're
the tip
pressing,
of the thumb.
yeah, so that you're again keeping the good contour in here, and you're strengthening the muscles that are in your hand itself, not the long ones that come all the way up to here. You're going to touch your thumb and finger together, and you're going to make sure that you have a good contour of this curve here, which you do right now. and you're going to start increasing the amount you can pinch. But what you're going to do is if it starts to collapse in here, you got to stop and start again. So in order to get the feel of the position you need, you may need to support it with the other hand just to get this joint out into making it more of a circle rather than collapsing in like I can do if I try. So as long as you're keeping this good contour here, yeah, don't bend your finger too much. Because then you're using different muscle. But stabilize and now pinch. And see, hold it, hold it, hold it. Hold, you don't even have to do it again and again, and not so fast, but just and see if you start to...
Starting to collapse?
Yeah, well, you've got, as long as it's around, it's going to stabilize and you'll feel like you're strengthening the muscles to help this joint as well as this joint by not allowing it to collapse in, but keeping it around and contouring here. Okay?
Okay.
Got a trigger finger, which is basically a tendon down in this area that gets a thickness. And so it snaps as it's being pulled into its sheath and it snaps back out again. So what you want to do is help it to smooth out so it's not getting irritated. And one of the reasons I think it's getting irritated is because it's got more rubbing as it comes around when your thumb is hyperextended, meaning that you're safer on the tendon if you keep your thumb this way. So I think that if you do these exercises to strengthen the thumb here, it will help you to not have the irritation of this tendon here.
I see.
Okay.
Will that remain, that little nodule? Or you don't know?
Well, there are some things you can do that I teach people for helping with tendonitis in there. One is to massage it or even relax. Let me just hold you. And you can feel like there's a little thickness right in that area. So one thing I do is I kind of put it into a stretch position. Does that feel like a good stretch right now?
Yes, it does.
And hold it for 3 minutes. Just
You'd have to do that too.
using, it has to be someone else because you can't stretch it yourself. You need 2 hands. And when you're holding it for 3 minutes, basically what you're doing is you're giving time for the fascia, which is connective tissue, to unwind and become more normal. Basically what you have when you have an injury, and let's consider this an area where there was injury leading from a repetitive strain or something like that, the fascia, which normally is an open mesh like a loose knit sweater, shrinks and all holes shrink up. So this is a technique to help open up the fascia again. And, if you hold it for 3 minutes and you wait, hopefully you get a little relaxation of the fascia and it won't be so tight and bound down in that area. So I can keep holding it for a few minutes and see what happens, and then I can show you something else. Okay, so the other thing, I typically will use some oil on this area just to lubricate
I can get
it.
some more.
Well, I was okay when I tried it on myself. Relax. And I'm going to take this spoon, I'm looking fumbly here, and I'm going to rub. You feel that crinkly as I go over that area?
Yeah.
That's an area, that you want to work on. And basically what you do, you go in one direction.
Now, can she do it, or do I need to do
You
it?
can do it too. And you can go back the other way. And you're just looking for the places where it crinkles. Does it feel okay? And you're just trying to kind of break up little bound down, bunched up, whatever connective tissue that's inside that area. And after you do that a while, it should help soften it up. And the intent is to then allow it to, the cross links, the connective tissue that's in there, to heal in a way that's more flat and more normal, rather than being bulky and
It's like ironing
thick in
it
there.
out.
Yeah, basically. Okay?